Are steroids worth the risk? What are steroids? Steroids, sometimes referred to as roids or juice. They are similar to certain hormones in the body. These hormones help fighting stress and promoting growth and development. But some people use steroid pills, gels, creams, or injections because they think steroids can improve their sports performance or the way they look. Anabolic steroids are artificially produced hormones that are the same as or similar to androgens, the male type sex hormones in the body. There are more than 100 variations of anabolic steroids. The most powerful androgen is testosterone. Although testosterone is mainly a mature male hormone, girls' bodies produce smaller amounts. Testosterone helps build muscle and promote the masculine traits that guys develop during puberty, such as deepening of the voice and growth of body hair. Testosterone levels can also affect how aggressive a person is. Athletes sometimes take anabolic steroids because of their testosterone-like effects. Other steroids, sometimes called steroidal supplements, contain dehydroepiandrosterone (DHEA) and androstenedione, also known as andro. For the most part, steroidal supplements which used to be found at health food stores or gyms are now illegal and require a prescription. DHEA is one of the few exceptions and can still be bought over the counter. Steroid supplements are weaker forms of androgen. Their effects aren't well known, but it's thought that when taken in large doses, they cause effects similar to other androgens like testosterone. But research studies suggest that they do very little or nothing to improve athletic performance. Companies that make them often use false claims, and very little is known about the long-term effects some of these substances have on the body. That's one reason why the government took action to protect citizens by passing laws controlling steroid distribution. How do anabolic steroids work? Anabolic steroids stimulate muscle tissue to grow and bulk up in response to training by mimicking the effect of naturally produced testosterone on the body. Anabolic steroids can remain in the body anywhere from a couple of days to about a year. Steroids have become popular because they may improve endurance, strength, and muscle mass. However, research has not shown that steroids improve skill, agility, or athletic performance. Anabolic steroids cause many different types of problems: acne, premature balding or hair loss, weight gain, mood swings, aggression, sleeping problems, high blood pressure, great chance of injuring muscles and tendons, jaundice, that is yellowing of the skin, liver damage, stunted growth, increased risk of developing heart disease, blood clots, stroke, and some types of cancers. Risk for girls are increased facial and body hair growth, such as deepening of the voice, shrinking of the breasts, enlargement of the clitoris, menstrual cycle changes. Risk for guys, testicular shrinkage, pain when urinating, breast development, also called as gynecomastia, impotence, that is inability to get an erection, reduced sperm count, and infertility. Some users may become aggressive or combative, believe things that aren't true, that is delusions, or have extreme feelings of mistrust or fear, that is paranoia. And people who use steroids also appear to be at higher risk for using other drugs such as alcohol or cocaine. Steroid users who inject the drugs with a needle are at risk for infection with HIV. People who use dirty needles are also at risk for contracting hepatitis, a liver disease, or bacterial endocarditis, an infection of the inner lining of the heart. Steroids, stacking and addiction. Some people cycle their steroid doses. Stacking means taking two or more different anabolic steroids. Other steroid users may pyramid their steroids, starting with a low dose and gradually increasing the dose, frequency, or number of anabolic steroids taken, then tapering off to complete a cycle. Users believe that stacking enhances the effects of each individual drug. Pyramiding allows the body to get used to high doses of steroids, and steroid-free periods help the body recuperate from the drugs. A lot of people tell themselves they will only use steroids for a reason or a school year. Unfortunately, steroids can be addictive, making it hard to stop taking them. And once users stop taking steroids, they can have withdrawal symptoms such as loss of appetite, tiredness, restlessness, insomnia, mood swings, and depression. Strong alternatives to steroids. Anabolic steroid use is illegal and banned by professional sports organizations and medical associations. In spite of this, some athletes continue to take steroids because they think it gives them a competitive advantage. As seen in high-profile cases, if an athlete is caught using steroids, his or her career can be destroyed, and there are serious health consequences. When it comes right down to it, harming your body or getting disqualified aren't smart ways to try to improve your athletic performance. Being a star athlete means working hard and training the healthy way, eating the right foods, practicing and strength training without the use of drugs.